I am Sister Sally from Infection Control Department, King Salman Hospital. We will talk about ESR in infection control. This is infection control manual. How you can access the infection control manual? It is available in the desktop in the shared file. Our manual is updated on January 2022. It is valid up to 3 years. Now we will see the ESR standards. What do you mean by ESR? ESR means Essential Safety Requirements. For infection control, we have mainly 2 standards. One is IPC4, Infection Prevention and Control Committee. This standard we have 4 substandards. These substandards, they are asking about how frequently you are conducting the meeting, who are the team members, who is the chair of the committee, what is your agenda. Second one, IPC 50. Facility design and available supplies support isolation practices. This standard we have 8 substandards. How they will evaluate the standards? Are we met or no? By observation, staff interview, document evidence. They will observe for negative pressure room, hand hygiene facility, isolation precautions and availability of N95 mask, donning and doffing of PPE. Staff interview, awareness of negative pressure rooms and engineering controls, isolation policy, appropriate use of PPE for airborne cases, fit test, reusing and extended use of N95 mask. We will talk about this, what is reuse and extended use. Extended use means the mask is used for the whole ship without removing. Reuse means for multiple encounters in one ship under condition that it should be kept in safe and good condition. Documents needed: negative pressure room monitoring sheet, HEPA filter changes record, air changes per hour records, maintenance records and fitters cards. Now we will go to hand hygiene. There are 2 techniques of hand hygiene. One is with soap and water, other one is with alcohol based waterless hand rub. Hand hygiene is used to kill microorganisms that colonize the hands. What are the 5 moments of hand hygiene? Before patient contact, before clean or aseptic task, after body fluid exposure risk, after patient contact, after contact with patient's surroundings or environment. Now you can see how to wash with soap and water. So everybody should know about how you will wash your hands with soap and water. The technique is important, duration is important. Before doing the hand hygiene, there is criteria. Your nails should be short, there is no hanging jewelries, no artificial nails, and your sleeves are long, it should be fold up to elbow. The duration 40 to 60 seconds for washing with the hands with soap and water. The technique: First, open the tap, wet your hand. Take adequate amount of soap solution. Apply palm to palm. Right palm over left dorsum, left palm over right dorsum. Between the fingers, back of the finger opposing both the sides, vice versa. Tip of the fingers. Wash your hands properly. Take the tissue. Dry your hand. Close the faucet with same tissue. Your hands are clean. Now I will explain how you will do the hand rub with alcohol. The duration 20 to 30 seconds. Take the adequate amount of alcohol. Apply palm to palm. Right palm over left palm. Left to right. Between the fingers, back of the finger opposing. Rotational movement of the thumb. Tip of the finger. Your hand is clean. Now we will go to PPE. What do you mean by PPE? Personal protective equipments. Here the importance, how you will donning the PPE and doffing the PPE. Now we will see the donning of PPE. You have to do the hand hygiene before touching the personal protective equipments. Start with gown, then the mask, surgical mask or N95 mask, face shield or goggles. Last will be the gloves. I will show you the picture how to put on the PPE. Clean your hands, put your gown. You have to tie both the strings properly. Put your mask. You see the mask how it is tied. It should be separate. One is above the ear, below the ear. Eye protection. Put the gloves. Now we will see how to remove the personal protective equipments. First you have to remove your gloves because your gloves are more contaminated than other PPE. Clean your hand. Remove your eye protection if you wear. Otherwise go to gown. Remove your gown. Clean your hand. Remove your mask outside the room. Clean your hand. Now we will talk about transmission based precaution or additional precaution. In the hospital we will apply all standard precaution. Some cases there is additional precautions called airborne precautions, contact precaution, droplet precaution. How you will differentiate? There is color code. Blue is for airborne, green is for contact, red is for droplet. What is the requirement for airborne precaution? Negative pressure room with fit tested seal check N95 mask. What are the conditions? You will isolate the patient under airborne. Pulmonary TB, measles, chickenpox, monkeypox, critically ill MERS-CoV or COVID-19. Contact precaution. Patient should be in single room. What are the conditions? Multi-drug resistant organism, MRSA, methicillin resistant Staphylococcus aureus, PRE vancomycin resistant Enterococcus, infected diarrhea, Clostridium difficile, infected wound. Droplet precaution, if possible in single room. Meningitis, influenza, COVID-19, mumps. These are the poster. You can see the Airborne precaution poster. Color code is blue. Requirement is negative pressure room, fit tested, seal checked N95 mask. And door should be closed always. First you have to clean your hand, use your all PPE. While coming out, you have to remove your N95 mask. Contact precaution. You will clean your hand. You have to use your gown and gloves. Droplet precaution. Again, hand hygiene, use your surgical mask. Now we will see AIIR, Airborne Isolation Room. There is at least one airborne isolation room for every 25 beds in general wards. At least one airborne isolation room in the emergency room. Airborne isolation rooms fulfill all MOH specifications for standard isolation rooms, plus windows are sealed and fixed. That is, could not be opened. Openings in walls and ceiling are sealed and airtight. Doors are properly designed and well sealed. Airborne infection isolation rooms are under negative pressure. Pressure should be minimum -2.5 pascals and above, with air totally exhausted to outside 100% through high efficiency particulate air, that means HEPA filters. The exhaust air ducts are independent of the building exhaust air system. There is a fixed monitor outside the patient room in the corridor to continuously monitor the pressure difference between the patient room and corridor, with activation of audio-visual alarm when the ventilation system fails. I hope everybody knows about the monitor is fixed outside the all negative pressure room. There is evidence of regular monitoring of negative pressure difference of airborne isolation rooms. How you will monitor the negative pressure room? Daily when patient is inside the isolation. Weekly when not in use, that means there is no patient is isolated. Monthly check by biomedical personal's HEPA filter is changed on a regular basis and according to manufacturer's recommendations. There is evidence that air exchange of airborne isolation room is more than 12 air changes per hour with regular monitoring at least quarterly. Airborne isolation rooms are used only for isolation of suspected or confirmed cases with airborne infectious disease, not for ordinary patients. This is the negative pressure room monitoring sheet. In all negative pressure room outside it is posted there. This monitoring sheet should be followed by the head nurse or the charge nurse daily. According, when patient is inside daily, patient is not there inside, it should be weekly. Monitor for temperature. Temperature is 21 to 24 degree centigrade. Humidity 30 to 60. Pressure -2.5 and above pascals. And the engineering controls should be by the ACH should be checked by the engineer and they should monitor here. Now we will see the location of negative pressure room. In our Kings and Man Hospital, we do have 12 negative pressure rooms. These are the locations. Like ER, respiratory area, we have one negative pressure room. The first floor, A1 surgical ward, one negative pressure room. B1 medical ward, one negative pressure room. C1 isolation ward, one negative pressure room. Day surgery unit, one negative pressure room, intensive care unit. We have two negative pressure room. One is inside ICU number 5. One is outside ICU. This is number 13. This number 13 is not having anti-room. Other all negative pressure rooms are having anti-rooms. Second floor, A2 surgical ward, 1 room. B2 medical ward. Again there is 2 rooms, 209 and 210. C2 OB-GYN ward, 1 room. D2 isolation ward, 1 room. Now we will go to N95 mask fit test. When you will do your N95 fit test? Upon your hirement, you have to go to employee health clinic. You have to do your fit test to know your size. We have small size and regular size. Different types of N95 masks. These are the size, small and regular. Different shape, 3M V-Flex, Kimberly-Clark, 3M cup shape, BYD Care 3M. Unfortunately, we do not have Kimberly-Clark, V-Flex and 3M cup shape. Now we have only BYD Care. This is the BYD Care. 3M BYD Care. When you will use, the patient is on airborne isolation. How you will use? You have to seal it properly. Fit tested, sealed N95 mask you have to use it. You can see there is one machine called PAPR, Powered Air Purifying Respirator. It is called PAPR. In all departments there is PAPR. The fit test to be done every year. These are the parts of the PAPR. There is one hood, battery, connection to, and the machine. You should daily charge the machine. Then only you can use it for one shift. Who can use the PAPR? A PAPR may be selected for use if the N95 respirator choice does not fit. Employee has facial hair or facial deformity that would interfere with mask to face seal. The N95 respirator choices are unavailable. Decide for high-risk aerosol generating procedures. PAPRs can be used by persons who are medically certified but who cannot wear N95 disposable respirators. Example, persons with facial hair. This is the appearance after putting the PAPR. You can see the picture. PAPR is turned over the blue gown to ensure proper airflow. Be sure the hood extends to the shoulders and fully covers the neck. Be sure the hood covers all of the hair and ears and that it extends past in the neck to the shoulders. Extra care is needed to ensure skin does not become exposed with movement while wearing a PAPR. If this is not possible, do not enter into the patient room. Do your hand hygiene. Use your PPE properly. Isolate the patient in according to the priorities. Let us give everyone a clean hand. Thank you.